Disobedience. So I'm going to start by telling kind of how we got to this point now. So back in March, when the pandemic was declared an emergency and everything got locked down, everybody was a little scared and they wanted to do their part. So we shut down the restaurant, we complied with all the orders, but I was looking around and going, well, if there's such a deadly pandemic, how come nobody around me is getting sick and nobody's dying? And you're looking at the statistics, and they would always show you, you know, on the news like CTV and CBC, the numbers of people dying, but there'd never be any comparison to previous years. And there was all these new metrics that were being discussed, like the number of positive cases, which you never heard about before. You never heard any year how many positive flu cases there were. I mean, for years, like you can look back, you can search up yourself, hospitals overrun, 2012, 2013, 2014, 2015, 2016, 2017, 2018. Try it out for yourself and see. The hospitals being overrun during the cold and flu season has been a problem for like a decade, maybe more. I haven't looked back much before that. So it seems like the responsibility here should really lie on our government to increase the capacity of our healthcare facility, not shut down small businesses. Then I did a little bit more research and I started learning about the PCR tests and the high cycle threshold that's used in a lot of countries. And this was really driving up those positive cases that were putting us in and out of lockdowns. So when the Premier came out with the new color-coded system that was all dependent on the positivity rate, and you could be put into lockdown based on how many people were positive, but it didn't really have anything to do with real world metrics like ICU admissions or overall mortality. So I reached out personally to Dynacare and Life Labs to see what their cycle thresholds that they were using were for their PCR tests, and they were using 40, 42, 44. Even Dr. Fauci himself said that that was going to lead to just picking up dead nucleotides, and those particles they were finding were not replication competent, which means that they weren't really getting anybody sick. So this whole idea of asymptomatic transmission seemed to be a myth as well. Yet we're all out here every day wearing diapers on our mouths to try to protect people from something that's invisible and hasn't really had an effect on any real world metrics at all. So I also noticed how there was in other countries data coming out about how long-term care homes were being really affected by this virus, this alleged virus that is yet to be isolated. Yet nothing was being done to protect these long-term care facilities. I was thinking to myself since last June, why don't they just put the rapid antigen testing and 2 nurses in a tent outside every long-term care facility and make sure everybody coming in and out doesn't have COVID? But instead, they gave CERB payments to hundreds of thousands of Canadians. And I'm not a doctor, nor am I a scientist, but it made sense to me that it would probably be a lot less costly to just implement the proper security measures outside of these facilities. Then other things, like the studies that came out of Korea about how the people dying from COVID, it was like 10 times more likely to die if you had low vitamin D, yet they weren't supplementing us or giving people vitamin D or suggesting that they go outside in the sun. They were just saying, stay inside and stay away from people. So none of this was really adding up to me. So I started calling my local politicians. So I called my MPP, I called and emailed John Tory and Doug Ford, but never got any responses. So now I really feel like I'm out here on an island. Everybody that I'm talking to constantly is saying how it's a super deadly pandemic, but there's no real answers to the questions. There's only blind faith and obedience in this alleged pandemic. It felt like my only option left was to engage in civil disobedience. I told myself and a lot of my staff that if we ever got put into a lockdown again in the second wave, that I would open up against the provincial orders to bring attention to the issue and to challenge the Reopening Ontario Act in court. So you could see the predictive programming from the media like CBC and CTV and Global and CP24 that are all, I think, subsidized somewhere between $500 million and $2 billion a year by the federal government. I noticed that they were kind of leaking hints from Doug Ford about this second wave lockdown, and Doug Ford came out and said that he would not lock us down again, the restaurants, bars, and retail, without proper evidence. Turns out he did. 3 days later, he came out, locked us all down, and didn't provide any evidence. About a week later, Ontario Public Health came out and they gave us yet another new metric called Outbreaks. And allegedly these outbreaks were happening in restaurants. But it was really strange because we had been contact tracing in here for months, as were all my colleagues in the industry, but nobody I talked to had this contact tracing data collected at any time. So how were they determining that these alleged outbreaks were happening in restaurants? It made no sense. I said, screw it, we're opening up, we're engaging in civil disobedience. You guys saw what happened. The first day, there was a Section 22 order applied by Eileen de Villa issuing a closure notice on the property. And it said on that notice that she had reasonable and probable grounds to believe that a communicable disease existed on the property. I take issue with that because there was nobody that I saw there that was symptomatic. So how could she say that there's probable grounds to believe that a communicable disease existed on the property? So I ignored it. We engaged in civil disobedience again the second day. Had a successful day. I got my charges under the Section 9 of the Reopening Ontario Act, which is what I wanted to fight in court. We came back for the third day, and there was a Trespass to Property Act invoked on my building at 7 Queen Elizabeth Boulevard in Etobicoke. Now, under that act, only the occupier can apply that order onto a property, and the verbiage for what defines an occupier is somebody who is in physical possession of the property or somebody who's responsible for the maintenance and the operations therein. Eileen de Villa is neither of those. She was not in physical possession of the property and she's not responsible for anything that goes on inside. That's me. I'm the occupant of that building. Despite that, the police engaged in arresting me, took this Trespass to Property Act order at face value and arrested me for going onto my own property. This never should have been escalated to a criminal matter. This was purely a civil matter, and there were avenues for the authorities to take to close my restaurant with a Section 9 order. Now, they eventually did. Justice Kimmel, who was the judge presiding over my case, granted that, but did not run that order through the charter. Now, recently in BC, the government was seeking an injunction against a church for reopening, and the judge in that case did run it through the charter, and he made reference to my case, saying that Justice Kimmel did not consider the charter when making her decision. I think that's kind of concerning that our authorities are doing that. Now, in hindsight, after those 3 days of protest, where many of you were there, we had hundreds of people outside, hundreds of people inside. We were all shaking hands and hugging each other. Everybody was engaging in civil disobedience, and nobody got sick. There's been no contact tracing data revealing that anybody was sick, in the hospital, in the ICU, or died from anything that happened at my restaurant. So, after this all happened, I looked for some lawyers. I had a very hard time finding any lawyers that were on side. There was 3 lawyers that I had to fire because they did not want to challenge the government authority at all. And I finally came across a great team of lawyers. That's the Armstrong family. There's Nirmala, Amanda, and Michael Armstrong, as well as Michael Swinwood. They're my legal team. They are activists, and they have filed a constitutional challenge in response to my Section 9 order. This is an inroad for us to make this constitutional challenge, where many other people who have tried to do this have had their applications or their statements of claim thrown right out of the courts. Fortunately, we have an inroad through this Section 9 order where it cannot be thrown out at all. My legal team is working with international lawyers, with various experts, public health experts, and a number of PhDs who will be challenging all the evidence that holds up what's left of this narrative that there's a deadly pandemic that's at the risk to the general public, where small businesses should be closed down. All right, so that's how we got to this point.